Over the last 20 years, millions of people have had laser eye surgery, lured by the prospect of perfect vision and a life without glasses. But some patients say they've suffered devastating and irreparable damage and were never warned of the risks. 16 by 9 first reported back in 2011 about an American whistleblower who claims the procedure isn't nearly as safe as the industry would like you to believe. Now, U.S. regulators say advertising is skewing the picture even further. And as Sean O'Shea found out, it's not clear who, if anyone, is watching out for Canadians.
I was in and out in 2 hours.
Thank you, Rand Eye Institute.
2020 Institute's lifetime LASIK.
I'm getting married.
I heard about the
I had to wear contacts for that.
Laser eye surgery is aggressively marketed in ads like these we found on YouTube. It looks like a low-risk way to improve your vision and your life.
Restoring my vision.
Literally changing my life.
But the U.S. Food and Drug Administration wasn't impressed. So just this last December, they slapped this company and 4 others with a public warning for misleading marketing and not properly informing patients about the risks in its promotional materials. Those FDA measures came too late for Winnipeg resident Daniel Mouflier.
Hell. It's been hell.
A year and a half after having laser surgery, Daniel's vision fluctuates from minute to minute, and every day his eyes are painfully dry.
In the morning, my eyes feel like they're like sandpaper. They just hurt. I put drops in it as soon as I wake up. The pain varies quite a bit. It goes from dull to sharp. Sometimes it feels like there's a needle in my eye. It's unbelievable.
Daniel says he looked through promotional materials carefully before his surgery, but they didn't mention anything about the kind of pain he's experienced.
I found temporary complications. I never found anything long-term.
And when he asked his doctor about potential side effects, this is what he was told.
I may have dry eyes, blurry a little bit, but after the 3 months I was promised HD vision, was told to be better than what I saw before.
Instead, it has turned out to be far worse, and that reality has been difficult to deal with.
I take it day by day. I hope one day that it does get better. I hope that I'll have less pain.
More than 7 years after her own laser eye surgery went wrong, Sherilyn Guillemino knows how hard it can be to stay optimistic.
And you think it's hopeless. I'm going to be like this the rest of my life.
Her eyes are so dry, she has to wear special goggles to protect them.
These ones are for outside. They block the wind. So I wear these when I'm at home just because then I'm much more comfortable, but they look hideous, so I don't usually wear them out in public ever.
If you don't wear the goggles, what happens?
Oh, my eyes, I'd start getting those sharp stabbing pains when I blink, so it's just not worth it.
Like Daniel, she says she was never warned she could suffer life-altering complications.
Well, it's destroyed my quality of life that I used to have. Everything that was easy before is now difficult.
Every day, Daniel sees laser surgery being promoted around town, reminding him of the day his life changed.
Yeah, it hurts me to see it. I hate the idea of somebody else seeing those ads, thinking what I did, and ruining their lives. For almost anything else, medication-wise, there's always a warning afterwards, and I shake my head. I don't understand why there isn't even at least that.
For more than a decade, consumer advocate Wendy Armstrong has been watching how laser surgery is promoted.
I think there's a lot of advertising around laser eye surgery that promises a lot to people without identifying the nature of the risk that people face.
Wendy helped produce a report in 2002 suggesting nobody was minding the store when it came to advertising and recommending much more stringent regulation. Unfortunately, she says, Canadians have no better protection today than they did back then.
Most people believe that in order for something to be advertised, it has to be truthful. As a matter of fact, advertising around healthcare products and services are excluded from many of the traditional consumer protection mechanisms that we have here in Canada.
Unlike the U.S. FDA, Health Canada does nothing to monitor how medical procedures like laser eye surgery are marketed. That responsibility is delegated to the provinces, and they pass it on to the colleges of physicians and surgeons, which only respond to complaints. The Federal Competition Bureau is supposed to police misleading advertising, but again, unlike their American counterparts, they were unwilling to confirm even the existence of an investigation. So how safe is laser eye surgery, and what are the risks? Just listen to what this high-ranking American whistleblower says.
Is this a procedure that you would recommend to other people?
Absolutely not.
Morris Waxler was responsible for approving LASIK when he worked at the FDA in 1996. LASIK is the most popular form of corrective laser eye surgery. But now Waxler says he made a mistake and wants that procedure banned.
Well, we said that the adverse event rate should be no greater than 1%.
What percentage rate do you think had a problem with LASIK?
20 to 30%.
20 to 30%. That's at least 20 times higher than the 1% the industry claimed to get it approved.
Might there have been an incentive to conceal the truth or maybe even to lie in order to get this approved?
Absolutely.
Do you think that happened?
Yes, it did. The question is, how many eyes are you willing to ruin to make a living?
Here?
Dr. Guillermo Roca disagrees with Waxler and says catastrophic injuries are extremely rare. He represents the Canadian Ophthalmological Society and its 800 members.
It has been incredible in terms of the amount of precision, the safety, the efficacy that we have seen over the past 15, 16 years.
Still, he says, patients must be clearly informed about the risks, however small they might be.
We need to present the information to them, knowing that there are potential risks.
But how many businesses that offer corrective laser eye surgery do that? 16 by 9 went into 3 Toronto area clinics with a hidden camera to find out what patients are told. And in all 3 cases, the risks were glossed over or completely dismissed.
Your eyes are dry, and then it goes away?
Yes, it does get better.
Okay, that would never be permanent.
No, it's not permanent.
So those glare and halos and that goes away?
Yes.
There's not really any chance of long-term things?
No.
Add it all up, and Wendy Armstrong says consumers are at a clear disadvantage.
I'd be hard-pressed to know how any individual looking at having this surgery would be able to find out that information.
Daniel Mouflier says he did the research, asked his doctor, and was never informed he could end up with such severe and permanent pain.
Every single day. Every single day. I can't forget. The pain reminds me.
But the worst part is, some days he can barely see his 6-year-old daughter.
For me to, when I go pick up my daughter at the daycare, if I don't know what colors she's wearing that day, it makes it very hard because I don't know which kid's mine. She actually looks out for me, and when she sees me, she'll come to me because she knows I can't always see her. It's disgusting. It's heart-wrenching, honestly. You know, I'm supposed to be there to look out for her, and how can I look out for her if I can't even see her?